Removal of the appendix, called appendectomy, is performed when appendicitis is suspected. Right lower abdominal pain, fever, and elevated white blood cell count are common symptoms and signs of appendicitis, which usually occurs when a blockage develops between the appendix and the intestine. This leads to infection, swelling, and distension. If the appendix is not removed, it can lead to a life-threatening perforation or rupture. The only treatment for appendicitis is appendectomy, which is almost always performed on an emergency basis. Newer laparoscopic techniques require only tiny keyhole incisions or puncture wounds, which generally result in a shorter recovery period. An uncomplicated laparoscopic appendectomy usually takes between 20 and 30 minutes. To gain access to your appendix, your surgeon will use sharp instruments called trocars to create 3 small holes or ports through your abdominal wall. These ports are usually located at your navel or umbilicus and in the upper right and lower left quadrants of your abdomen. Carbon dioxide gas will then be pumped through the umbilical port to puff up your abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera are projected onto a video monitor in the operating room. Your surgeon will carefully examine the inside of your abdomen, confirming that your appendix is red, swollen, and needs removal. At this point, your surgeon will pass surgical instruments through the other 2 ports, grasp the appendix, separate it from the intestine, drop it into a specimen bag, and remove the specimen bag through one of the ports. After your appendix has been safely removed, your surgeon will instill warm, sterile salt water through one of the ports into the abdomen to cleanse the abdominal cavity and remove any traces of infection. The salt water is then suctioned out.